So I don't think there are enough words to describe what we have seen. So our prayers are with our nurse heroes who are at the front lines, who I'm sure have families to worry about, but they forgot their fears, their worries, about their families to take care of their patients. This is why we call them heroes, and they are true heroes. Our prayers are with them all. Now we will move to our second video, which is from Afghanistan this time, and it comes from a nurse and who would like to remain anonymous for privacy. But this nurse has been working for over 6 years as a nursing manager with National Cancer Control Program, and for 6 years as nursing manager in Kabul. And he has received government level awards for his commitment to nursing and has begun publishing about his day-to-day work. I hope one day we will have him as a panelist with us. Now we will go for the film.
Good morning, everyone. Please accept my greeting from National Cancer Control Program, Center Diagnosis and Treatment Cancer of the Jamriyat Hospital, Afghanistan. Most welcome to participate on the global power of oncology nursing. First of all, let me express my ambition to serve, assist, and care of the most needy patient. After new regime come to power in Afghanistan, working conditions in the hospital become desperate day by day. Unfortunately, in the crisis situation, a large number of the professional and technical medical health worker cadre have left their profession. Despite shortage of the resources, we were able to provide healthcare services for the patient. Daily 130 patient admits for the screening, diagnosis, and treatments, among 35 patients receiving daycare services including chemotherapy, medication, blood transfusion, and surgical procedure intervention. We are 34 beds for inpatient on medical oncology unit and 24 beds for surgical oncology wards, 2 operation room, 4 beds recovery room, chemo preparation without safety cabinet, dressing room, endoscopy, diagnosis services, corneal, FNAC, walk-in clinic, and these services performed by 80 nurses during crisis of milestone. There is not ration between nurses per doctor, also nurses per beds. Humanitarian and economic crisis affected for the patient property. They are not have enough budget to buy their medicine and perform their imaging. Nurses not having time to participate for the training, morning reports, and visiting particularly. Another challenge how to treat these who comes from poverty without critical condition as a human being on the end of life. For those also provide services free in charge by support of the hero nurses. Therefore, early diagnosis and screening not done on time. Late stage of the cancer causes of the economic problem. Afghanistan is a landlocked country crossroad of the Central Asia and South Asia, located to the edge of Asia. It is bordered by Pakistan to the east and south, Iran to the west, Turkmenistan to the northwest, Uzbekistan to the north, Tajikistan to the northeast, and China. Its population is 40.2 million. The country's natural resources including coal, copper, iron, lithium, uranium, gold, zinc, talc, sulfur, marble, precious and semi-precious stones, emeralds, sapphire, tourmaline, leslie, ruby, and so on. Natural gas and property. The U.S. Geological Survey estimated from one mineral at least $1 trillion. So why Afghanistan always been fighting not a stable and peaceful environment? Because of the natural resources, not extraction. Thanks for your attention. God bless you. LTR of the nurses can decrease medical error. We hope that with exchange of view and experiment improve your oncology leadership management, which accountable your expectation. Thanks a lot.
Thank you for our colleague from Afghanistan who gave us a view about what nurses are living there. Now we're gonna move to our panel session. We're gonna see and listen to colleagues from different countries about the strategies that they are using to really approach oncology nursing in crisis situation. And believe me, those colleagues are also like our colleagues in Ukraine and Afghanistan are living in a crisis situation, and still they are facing it. They are taking care of patients. They are coming to work on a daily basis despite all the obstacles. So we will start with our colleague from Syria, but we have also Amal Safadi, we have Mariam Ndagire from Uganda, and we have Vera Samba from Cameroon, and we're hoping that Asif Hussainyar from Afghanistan would join us. I will start. Can we have the slides for Amal regarding her background, please? So I'm not gonna repeat what she has written about herself, but we're very honored to have with us Amal, who has been working for the past 11 years as a nurse, and she's one of the pioneers in keeping oncology nursing running during the war that was happening in Syria. And Amal will be talking in Arabic, and we will try to translate. So أهلا وسهلا فيك Amal. Welcome Amal to our panel. Can we remove the slide please now? Stop sharing. أهلا وسهلا فيك Amal. Welcome Amal to our panel discussion. Also, we have Mariam from Uganda. Can we have a presentation of Mariam's slides, please? Mariam is another hero from Uganda, and she's a senior pediatric oncology nurse. And she is also involved in a nursing education session. So we're very honored to have Mariam with us as well. Can we remove? We have Vera from Cameroon. Can we have her slide, please? If we don't have slides for Vera, we can say that Vera is also an oncology nurse at Mopi Baptist Hospital under the Cameroon Baptist Convention Health Service, and she coordinates the childhood cancer services and conducts home-based palliative care. And yeah, we have it. So thank you very much for the all the members with us. Is Asif with us? I don't think that he joined. Hopefully that he will be joining soon. I will start by posing.
Coming.
Okay. I will start by posing the question to Amal, and I will, as I said, I will pose the question in Arabic, and then she will answer. But I will say it in English now. How can you describe the situation in your country, Amal, and how is it affecting oncology nurses? سؤال رقم واحد, Amal.
Thank you. I speak English.
Okay, great, Amal.
Over the past few years, war has affected all aspects of life in Syria in different phases. Between 2012 and 2018, security was the main concern for Syrian people. Between 2018 and now, economic crisis has affected all Syrians, oncology nurses. Nurses are now working in different hospitals with multiple shifts every day, trying to secure enough money to have a decent life. Many nurses left the country, causing shortage in nursing staff in all specialties, including pediatric oncology.
Thank you, Amal. Thank you, Amal. So you had the safety, economic problem, and shortage of nurses. We will move now to our second panelist, Mariam, with the same question, Mariam. How can you describe the situation in your country and how is it affecting oncology nurses?
Good morning and good afternoon to everyone. First of all, I will say that in Uganda, we are not right now in a crisis situation, but our center takes care of many patients and so many refugees coming in from neighboring countries. Uganda is bordered by around, I think, 2 or 3 countries that are going through civil war. And because of this, it has an influx of very many refugees moving to Uganda to seek asylum. And so our center receives so many refugees who keep coming from different parts of Africa to take refugee because we have an open door policy. And because they are coming from different countries with different cultural backgrounds, different languages. So when they come to Uganda and they come to us at the Uganda Cancer Institute, it is not easy for them, neither is it easy for the nurses. The situation, you can imagine the psychological torture they have been through, taking care, they have faced displacement from their homes, they have gone through civil war, they have traveled for miles, they have walked for miles to arrive to the different camps where they are. And then also addressing those challenges. And then they get to the Cancer Institute, you're arriving at nurses who do not speak the same language with. So communication is really a key point, and it is one of the really problems that the nurses face. We do not know how to interface with these patients. We speak different languages, psychosocial and psychological challenges. People who have been in civil war, they need a lot of a comprehensive and multidisciplinary team to address these challenges. However, Uganda, like many low middle income countries, is faced with staffing challenges. And so some of these gaps are not, may not be seen as priorities. For example, having a psychologist instead of hiring an oncologist or as a nurse. And the bulk of this work falls to the nurses, who are non-trained psychologists, but they have to pick up the slack. They have to take on these patients and provide the psychological care that the patients need. But then the nurses as well, who are working under these dire situations, you're already having very terrible staffing ratios. You're looking after a patient you cannot communicate to. You do not know how to help these patients because you're not a trained psychologist, but you have to do this job because it has to get done. They're also facing psychological issues out of this. And there are no really institutional policies that are protecting nurses, that are providing the psychological care they need, or there's no training really that has prepared us for how to handle such situations. And then also when you look at cultures, you are receiving refugees from different countries with different cultures, with different perception of what even a disease is, what is an illness. And so really trying to explain to them how the disease is, trying to explain to them how the treatment is going to be, trying to, for example, let me say, we have people from cultures that are coming to us where you cannot say express pain, where saying that I am in pain may be seen as unmanly. It may not be a priority to them, but in cancer care, pain is a priority. You have to address it. And so because there's no good communication, the cultures are different. We do not know really, we have not been prepared how to take care of these patients who are from really different cultures. And then even the places where I work with, there are very many unclear policies on how to handle these vulnerable populations. We do not have the policies of how to take care of refugees, but they are here and we have to take care of them. We do not know how to help them. They will come, they're in the resettlement camps and maybe they are suspecting cancer. Next thing, they are put in an ambulance, they are brought to the hospital and they are just, I don't want to use the term dumped, but I'll say they are dumped there and you have to take on this care, but there is really no continuity of care. You do not know the history of where they came from, what has been done for them. You do not know where to start from. They are interfacing with the first person, the nurse that the patient are interfacing with is the nurse. But now the nurse does not even know how to take on this patient. You cannot take, you want to take, let me say the triage them, take vital observations, they are traumatized, they are fearful. And then the nurses have had stories of patients who are coming from war zone areas. They are fearful to touch the patients because they are not prepared for them. And so it is a scary situation, a two-way challenge. You really don't know how to help these patients. Even patients who might come with curable cancers, you have issues of treatment adherence, because you cannot keep them in the hospital forever until they complete their treatment. And so when you say let's discharge them for a short while, where are they going is the question. Even when they are going back to the camp, then to come back to the hospital becomes a challenge for us. It is a very difficult on both the patients who are refugees, but also truly difficult on the nurses.
Indeed, Mariam, it's a big challenge. You're not only providing the physical care, but on top of your patients, you have an added number of patients, but also here you're talking about a different dimension of care, which is the psychological and social care. And we thank you very much for this. We would like to welcome our colleague, Asif Hussainyar from Afghanistan. Welcome, Asif. We move now to Vera. Vera, can you put your camera on? Is it possible?
Yes.
Hello.
Hello, Asif. I will come back to you. Vera, the same question. Okay. How can you describe the situation in your country and how is it affecting oncology nurses? And I would like to remind our audience that Vera is coming from Cameroon. So the floor is yours, Vera.
Thank you very much and welcome everyone to GPON. I want to give you a recap of Cameroon. Cameroon has 10 regions and I work in the Cameroon Baptist Convention Health Services, which is a faith-based organization. And Cameroon is a bilingual country with 2 regions speaking English and 8 regions speaking French. And so my organization has 3 hospitals which offer medical and surgical oncology services to adults and children with cancer. And patient follow-up and home-based palliative care is wonderfully done by these services, especially the childhood cancer service. In 2016, a sociopolitical unrest started in the English-speaking region, and it led to armed conflict in 2018 with many armed separatist groups, which led to disruption of schools in most rural areas in these 2 regions. And more than 1 million people are displaced, mostly internally, but some are externally displaced. We have frequent lockdowns of businesses, the roads are blocked, people cannot travel. Many men have left their homes, leaving behind the wives and the children. And the health facilities are closed, or the health facilities that are not closed, they have limited services, constantly interrupted. And therefore, this has caused a strain on healthcare services. There is increased poverty, increased cost of living, increased transportation costs. And the COVID-19 also came in 2019, since March 2018, and then worsened the situation. Now, how is this situation affecting oncology nurses? There is difficulty for patients to travel to the hospital because there's increased poverty. There's insecurity, roads are blocked, There's prolonged lockdown and people cannot go to the market, they cannot sell their goods. There is also increased late-stage presentation, especially of children with cancer. The primary healthcare professionals were trained in early warning signs of pediatric cancer, and they were taught how to refer. We had connection, they would call us. But many of these nurses have left the health centers because of the crisis. Therefore, the suspicion and referral and subsequent diagnosis and treatment is late. Follow-up visits, which we used to do to the communities in the Northwest and Southwest regions, and home-based palliative care services have been interrupted, both for adult palliative care and for childhood palliative care. And for the staff, there is burnout, you can imagine. And there is underuse of our satellite pediatric cancer services. One of our cancer services where we started was Banso Baptist Hospital. Many of our patients used to travel to come there. And so the service was there and we couldn't have patients because the crisis really hit that region hard. And another way that it affected oncology nurses, we are living apart from our children, because the schools are closed, our children are in other regions, and then we live where we work. So this has really been challenging.
In fact, it's very challenging, and with every presenter, we're seeing different kind of challenges. We have seen with Vera that nurses are leaving their families for a long time to stay at the hospitals. They are burned out because of what they are seeing, because of the situation. We have the insecurity that we share with Amal. Now we're gonna move to our colleague Asif, who joined us from Afghanistan, and I will repeat the same question, Asif. How can you describe the situation in your country regarding oncology nurses, and how is it affecting your nurses?
Hi, everyone. Yeah, as you know, Afghanistan, the situation in Afghanistan is fragile and post-collapse of our government last 1.5 years before. And here the situation is not good that much like other countries. And people are in uncertainty. And there is a lot of nurses migrated to other countries, and the situation is not good, especially for girls and for female staff in Afghanistan. And but it is also affecting in oncology nurses, and as our before in last government, and there was very less center for oncology in our whole country. There is just one ward, not in even hospital. There is just one ward with 50 beds in one of the hospital, and with two just chemotherapy center in the region, in two regions of Afghanistan, and they are just providing chemotherapy to the cancer patient. And now in Afghanistan, the border are closed, and people cannot go to the neighbor country like Iran, Pakistan, and other country. And before there was availability of flights, and the border were open, and people can easily move to and seek help in other countries. But nowadays there is a lot of rushes of patient in these three small center of oncology, and just seeking oncology services. And there is also lack of medicine, and we don't have medicine in the centers. People are also the medicine are expensive, and they are not afford these medicines. And there's a lot of issues happening in our countries.
Thank you, Asif. I know if we want to speak about this topic, it might take us not only an hour and a half, but maybe 30 hours and we will not finish. So I will move to the other questions, but please, I want you to be very brief so that we give time for everyone to present. I will go back to our colleague Amal from Syria. And of course, Amal, when you were presenting, you spoke about, you included the strategies that you implemented. I'm gonna move to the third question. How are you living under these circumstances? كيف المرضى بسوريا عم بيعيشوا تحت هالظروف هيدي oncology nurses?
We are trying to adapt it with the current condition. We are challenging even ourselves to keep supporting the children with cancer and their families.
Thank you, Amal. Mariam, how are you doing as nurses? How are you living under these circumstances? You don't have the problem in your country per se, but you're living this with the refugees, and there is an added work, added pressure to your nurses. So how they are living with this? Mariam?
Thank you, Myra. Of course, you come to work, you do the best that you can, but then also mainly because the strategies employed by really the nurses to deal with these self-reliant strategies, you rely on your colleagues, you brainstorm, you discuss issues. We sometimes bring it to our meetings and how do we help these people? And then also to try to be part of the multidisciplinary team to try and really advocate for these refugees, but then for ourselves as nurses as well. And to really, because the biggest impact is the psychological challenge that we face, because it may seem minor, but it has a big implication really, because you are carrying these patients back home with you. You look at the problems and you do not know how to address them. Communication, you cannot really communicate with the patient. You cannot express what you want to do with them. We have been, sometimes you can get translators, that is if you're lucky and there's someone who is speaking the language that particular day, but when there is no language, then it becomes difficult. If you can reach out to members on the team, we've tried to work as a multidisciplinary team. We have realized that you cannot do this alone, but with a team members, such that at least on the team, you might find someone who speaks the language. We have tried to have partnerships with people who can help, humanitarian organizations that take care of refugees. Some can provide psychosocial support for them, of course, but that is when they're out of the hospital. But in the hospital with us, the situation is really difficult. We use self-coping mechanisms. Some people will tell you they pray, they discuss with a family member, but what has worked for us is really talking as colleagues about it. And then recently there's the WCC, the World Child Cancer. It's got a psychologist that has been helpful for sub-Saharan African nurses that offers online psychological sessions, those who want to log in and getting self-coping strategies and how you can help yourself when you're really faced with such challenges. And that has been a bit helpful for us. Thank you.
Thank you, Mariam. I go back to Vera, the same question. How are you living under all these circumstances that you described to us, Vera? What are you doing? How our nurses are coping? What are the coping strategies that they are following to survive?
The first thing we do is that we just communicate. Among ourselves, we encourage each other to keep safe. We make phone calls, we have a WhatsApp group to find out what is going on. And then we created a new pediatric oncology center out of these two regions. That is where I work currently. And this has helped us. We actually hoped to transfer the pediatric oncology center, but because of frequent roadblocks, it serves also the adult patients. So when the road is blocked and the people cannot go to our main center, then they travel easily to where I work as adults, and then we are able to offer chemotherapy to them. We also have improved the way we refer. When you refer a patient to communicate with the people at the center that the patients are going, and the hospital where the crisis is also, our main hospital acquired a bus, and the bus leaves the rural area, the village, and comes to the town, and it carries patients from the town to the village and back, so that they are able to have more confidence, and it is safer, and then their treatment is not interrupted.
Okay. Thank you, Vera. Meanwhile, we're receiving questions. I will address these questions as soon as our presenters finish from answering the current question that we are dealing with. So the question is for you, Asif, again. You described that you have 3 small centers. Afghanistan is a big country. You cannot send patients outside the country. Your nurses are under pressure, and especially female nurses. So how are you dealing with this? How are you living, surviving under these circumstances? How are your nurses?
There's as our nurses are brain drain, burn out, and there is like very less number of female nurses working in an oncology ward. And yesterday I went to one of the region, and I visited this center in Herat Center, the chemotherapy center, and I gave them hope that one day there will be some solution for you. We will be providing, we are helping to engage with international organization and international society to provide you some trainings and send you for the scholarship there. And but there is no any coping strategy mechanism for them currently. They are just dedicating themselves, and they are just working in just for the sake of human being. They are working, and they said, no, if we are not working here, and if we although there is a lot of issue and pressure, but if we are not working here, who will take care of these patients? And they need our helps, and this is all their hard working, their dedication. I told them, and I discussed them with them in yesterday, and they said, we are here. And there were some volunteers also, and they are just providing care for the people. For female nurses, there is issue still, social restriction in our country, and some issues there, and we are trying to find some volunteers or some international society to help them, and these are all the situation in Afghanistan.
Hats off to all of you wherever you are. Now I will move to the question, and it's for you, Asif. It's from the audience. Given the pressure on your services, are choices made to only treat people with highly curative cancer? For example, just those cancers that are very sensitive to chemotherapy. So in other words, do you turn patient down because they don't have good prognosis, not because you want to do it, because of the limited number of beds, or you take first come first serve? So how do you deal with the situation?
This is another issue. I discussed yesterday. I discussed them. They said that there is a long list, and we have just 10 beds there, and we made the long list for them, and every 10 to 15 days or some time, 1 month after the turn will come, their turn will come. And in some, there is some small or maybe some nursing home, they are like seeking in doing chemotherapy over there in some nursing home outside these center, which is not correct and which is not like standardized, which is not good for them, because but they are in sometimes they are going to other countries in to Iran and Pakistan, and nowadays the Pakistan visa is also very big issue. One Pakistani visa, they are like in getting in $1,000 for their patients, and there is a lot of issues there. Yeah.
So this is another issue, yes,
Yeah.
important issue, because
Yeah.
some patients who may have good prognosis may not have the may
Yeah.
not be able to be treated on time to have
Yes.
this prognosis carried on.
Yeah.
So
Yeah.
I will move maybe to our last question for this panel. Amal, I go back to you. How can we advocate for you as GPON? What can we do to help you? What are your needs and priorities? And if we ask you to choose one thing, one priority, what would that be? أمال رح نروح على آخر سؤال. كيف فينا نساعدكم؟ كيف فينا نحمل قضيتكم؟ شو هن القصص اللي عايزينها؟ وإذا فيكم تحطوها بالأولويات، وإذا في شغلة أولوية واحدة بدكم تنقوها، شو هي؟
Our priority in this phase of capacity building is to improve our academic performance. Training is necessary to keep up with all updates in the field of pediatric oncology. Finally, we hope that our voice is heard by all stakeholders in the field. We thank you. We thank GPON very much for giving us this chance to speak about the challenges we face and our future plans.
Thank you, Amal, and the honor is for us to have you with us. Please stay with us, don't leave now. Mariam, it's the same question. How can we advocate for you? What can we do to you as GPON? What are your needs and priorities? And if we make a difference, what it look like?
Thank you for this chance. I think what we need more is more educational programs for us in how we can address some of these challenges. We would like partnerships with partner us with people who can help us to provide psychological and psychosocial care for the nurses as well as for the patients we take care of. I would like to say that we need better policies of how to address these vulnerable populations. So maybe if we are equipped with knowledge of how to better advocate for these policies that we need for this, so that we can be able to help the people that we take care of. To me, I believe that to make all this work possible, the keyword should be collaboration and collaborating. So collaborating with us would really help us to empower us, not just to come and help us, but to empower us such that at the end of the day, we can be able to help ourselves in terms of education, in terms of, even if we would maybe say, we want to do something, but we need to know how to do it. For example, we can want to have, for example, I'll give an example of the center where I am is right in the middle of Kampala, and where these resettlement camps where the refugees are coming from. They're coming from really, they are having their bus ride, say, is 10 hours. It is very long distances from where we are. So if we can have programs that can help us that can go back to these camps where the refugees are coming from, to kind of like, because the focus in the camps is really on communicable diseases. The focus is on how to identify epidemics within those camps. And there's no focus at all on childhood cancer. And where am I getting with this? By the time these patients are coming to us from these camps, they are coming with advanced stage diseases. They're coming with wounds that are so dear. These are small things that can be done in the camps. How do we identify early childhood cancer warning signs? How do we partner with people who can help us to go back to these camps, to equip these people with some of these, I will not tell them life skills, but with basic oncology skills, identification, prevention, early warning signs, such that by the time they are coming here to us, something has been done for them in the camps. How do we, working with us to learn how do we build linkages? Because when you look at the care, it is fractured. We do not know where we are referring these patients back to. We do not, how do we build linkages? How do we work with these refugee organizations to make sure that we are providing the best care that we can for these children? Thank you.
Thank you, Mariam. I move again to Vera with the same question. How can we advocate for you, for your nurses? What can we do as GPON to help you? And what are your needs and priorities? And if we make a difference, what should it look like?
It's important to share our story with others. If they hear our story, maybe they can think of ways to help us, or ways to, give us counsel. If there is any way that we can cope better, we are open to suggestions on how to deal with this situation. And if there are known strategies, how oncology nurses in other crisis situations have used successfully, we are ready to know and adapt those strategies to our setting. We also would like for you to share scholarship opportunities in your countries with us. Inform us about oncology nursing conferences like this, where we will share, and if we know that we are not the only ones going through this situation, like we've heard from other countries, it's really encouraging and gives us the momentum to keep on pushing in our oncology nursing services. And we also desire training opportunities for oncology nursing. We have heard from our Emerald WHO representative. We do oncology nursing on the job training, but if we have online courses, that would be very useful. Oncology nursing resources from other countries, they are available, we welcome them. And lastly, if we have resources to guide parents, we may never fill the gap between us and our children. We live in a different region, the children live in a different region, something we never thought about. But we can reduce the gap, and we need your help to do this. Many staff, oncology nurses, other nurses, all the staff in our hospital really need support on this gap that we have with our young children. Thank you.
Thank you, Vera. I'm sure with leaders like the panelists that we have, oncology nursing, no matter what, will be safe in your country. And by highlighting what are your needs, I think more than 50% of the problem is solved, and I'm sure that together, hand by hand, we will really walk the talk of the title of this session, which is changing adversity to opportunity. So Asif, again, the same question. How can we help? How can we advocate? What are your priorities? And if you can choose one priority, and if we make a difference, what it should it look like?
Yes, currently, as I said, currently Afghanistan need cancer hospital. First of all, we need for a cancer hospital. In this hospital should take care of all the cancer patients. And secondly, we need some training for our nurses. Our nurses are not receive any formal palliative care trainings. In few of them, in this three trainings, this three cancer oncology center, they just receive a 2-week training for regarding oncology. And the newly appointed nurses did not receive any formal training regarding oncology nursing. We need some training inside the country, and also some providing some scholarship for nurses to go outside the country and get some trainings outside the country and get some experience from them and bring those initiatives and those things and implement in the country.
Thank you, Asif. Thank you for our panelists. And if I want to summarize what are the needs, we can say that a common denominator is the training for nurses, training, whether clinical training or academic training. Also, we have the need to have more beds and to work on retaining nurses. Also, we have the need for policy process, how to teach our nurses, oncology nurses, to work with policy in order to be involved and have the voice of nurses heard on the decision-making table. Also, we need some training at the psychological level to be able to support the patients, and also nurses themselves need support at the psychological level to remain there and not to be burned out and to continue all the good work. Some of the needs are strategies to adopt, but I'm sure once we have all the knowledge, the strategies will come up from yourselves and from the country to meet the country's need. So with having the WHO, Dr. Jadiq with us, I'm sure your voice is heard. GPON steering committee, all members are also listening. So I hope that your wishes and your priorities will be fulfilled. Sure, those are some of them are short-term, some of them are long-term priorities, but we promise that we will be working on them with you and for you, because all strategies, all plans need to come up from the ground, from the culture, from the nurses themselves. And thank you again for highlighting the voice of your nurses and the needs of your nurses in your countries. I would like to ask if we have more questions. Our dear panelists, if you have anything to add, we still have a few minutes, 2 minutes, if you have anything to add.
Myrna, I'll just sort of add in that there's a few people in the webinar chat sharing their experiences as well. People from Ghana, we've got Nazir Barat, he shared his experience in Afghanistan, and we're really sort of finding that there's some shared language happening amongst people. So I think it's really sort of highlighted to people just sort of how important it is to share your story, and also for us to think about how the organization we can help. The other thing just to say is in the chat there's lots of information. People are sharing links about who you can get in touch with, how you can keep involved with our organization. So really very interesting what people are coming up with.
And we have a question, what and how can GPON help us? If I can promise anything, I can promise that GPON will be your voice to the concerned people. GPON will do its best to try to provide educational support for your nurses, try to provide psychological support to your nurses, and a listening ear to you anytime you want. We're here for you to support you. And we learned a lot today from your experience, from what you are passing through, and from your resilience how resilient you are. We salute you for your resilience to really continue functioning under all the circumstances that you are going through. I think we are on time, and if I want to follow the schedule, I will leave the floor to Gulkan. Thank you very much.
So I think we're going to take a break now, Myrna.
Okay.
We've just got a 10-minute. We've got a 10-minute break until 11:40 our time, and we'll welcome everybody back then.
Okay, thank you. Bye.
Thank you.
استراحة ونرجع نكمل. انتوا خلصتوا؟ عن جد؟ ما خلصت الأسئلة.